Good afternoon, everybody. How's everybody doing? Stomachs are nice and full from lunch, so we're going to watch you do this as we talk, right? It's a possibility, but we appreciate all of you coming out this afternoon. This class or presentation was asked of us here within the last month, saying, hey, we need a more situational awareness for our employees over at Behavioral Health. And if you're going to get anything out of today's presentation, we want you to walk away today knowing just more situational awareness of your safety overall, right? When it comes to drug use and things like that, you are not the one giving, right, the narcotics and stuff to people, right? They are doing that to themselves. So they are putting themselves in a predicament. But at the same time, you as city employees, even at home with your own family members, when you're out on the streets every day, you got to have a situational awareness if you're going to help somebody that's having one of these type of medical emergencies. So again, biggest thing we want you to take away from today is what can you do to look out for yourself if you're put in a position where you have to respond to something like this or have to make a decision, okay? The more you see certain things and the more you experience them, kind of the more you're prepared, right? You have a card to fall back on. You've seen something happen before. You've handled this situation. You've either learned something from it, made a mistake and learned from that mistake. So all that goes into responding to these type of emergencies. And you over here at Behavioral Health, and I think part of this push for this training for y'all was because you're starting to see more where people are brought to you here at Behavioral Health saying, please fix this problem, right? Help us. So we're just, again, trying to give you a better situational awareness, how each one of you can look out for each other and then have the tools that you need to protect yourself and just be successful when you're faced with an opioid overdose or some type of drug use. So again, take some notes towards the end of the presentation. We're going to ask for you all to kind of report back, right? So we won't go one by one, but we want to try to at least pull 5 things that you learned today that you didn't know, and we'll do it as a group together. So we want you to pay attention, ask questions. If you have a question, raise your hand. If you have a question you want to wait to the end, just write it down. So we appreciate all of you being here today. And I'm going to turn the time over to Ashley.
All right. Good afternoon, everybody. Today we're going to talk about situational awareness for opiate overdoses. So this is not teaching you guys how to necessarily use Narcan, but this is teaching you guys not to keep the blinders on when we do have situations arise like this. We want everyone to be safe while we're also helping others, okay? So first I want to talk about some street or slang names that you guys might hear, because it's not very often that you guys have patients come in and they're like, oh, I use heroin or whatever. Some opiates, heroin, obviously, and then we have some synthetic stuff like fentanyl, carfentanil, oxy. You might hear someone use the name dope, cap. I think cap is probably the most common one that I've heard here in Portsmouth. They'll say, I take half a cap, or I took 1 cap. H, F, or O, I have not heard that one here, but it said that was pretty common. Snowflake, gray or white, dragon or dragon breath, girl, oxy, lean, purple drink. Those are some common ones. Okay. So opiate use versus overdose. We are using Narcan for opiate overdoses. We're not necessarily using it for somebody that has used heroin, okay? So the difference is, one is a real medical emergency that they can possibly die, and we want to prevent that. So for opiate use, you might notice that they appear euphoric, kind of act a little crazy. They might be drowsy, slow thinking. You might see the lean. They might have some nausea, vomiting, diarrhea, slurred speech. Now on to opiate overdoses. This is where our patient can be unresponsive. You might hear snoring respirations. So when they, I don't do it very well, but they might appear to be snoring. They might not be breathing at all or very shallow, like just a couple breaths per minute. They might be cyanotic or blue. Notice blue lips, blue fingertips, pinpoint pupils, and cold, clammy skin. So we use Narcan for opiate overdoses. We use this for the patient's respiratory drive. If they're not breathing, we're going to give them some Narcan. This is not for somebody that's walking into the building and they're like, hey, I took some heroin. Can you give me some Narcan? We don't administer Narcan for that. Okay?
One other thing I want to add to with the opioid overdose, in y'all's training on how to give Narcan, because has everybody in here had the awareness training for how to administer Narcan? Yes. Okay. Do they teach you at all to check for a pulse? Yes? Does everybody know how to check for a pulse? Because one other thing that opioid overdoses are going to have is they're going to have a very rapid pulse, meaning it's going to be the normal resting heart rate for you and I is in between 80 to maybe 120, or maybe a little less than that. Someone who is getting cyanotic or turning blue in the face or only breathing 1 or 2 times a minute, the brain is telling the heart to beat really fast. And why is it telling it that? Does anybody know?
Lack of oxygen.
Lack of oxygen. The brain says, hey, heart, I need more oxygen up here because I'm going the wrong way, so beat faster. So keep that in mind with these, the opioid use and the opioid overdose. That's another thing that you can check is what does their pulse feel like, whether you check it on their carotid or you check it on their radial, on their wrist. If it's really fast and beating really quickly, that's another sign of an opioid overdose.
Right. All right, so I'm pretty sure this is the type of Narcan that you guys carry, right? 4 milligrams, and you guys have 2 nasal sprays inside of it. All right, so once again, Narcan is used for respiratory depression in overdoses, meaning the patient's not breathing. We're not giving it to them running around, if they're running around, talking, acting odd, we're not giving Narcan for that. This is for emergencies, they're about to die, they need to breathe. We do not slam medication, meaning we are not going to just shove it all real quick into their nose. Try to be a little slower with it, take your time. I understand everyone's adrenaline's gonna go in emergency situations. And unlike us where we encounter this every day, it's not very often that you guys might be thrown into emergency situations like this, so we understand. Slamming the medication though has higher chances of causing these side effects. And Narcan does have side effects. I feel like it's a huge misconception that Narcan does not have any side effects. That's what everyone I feel like is taught. Even I was taught that 10 years ago in EMT school. It does have side effects. Not obviously from coming out of the overdose, we're gonna see agitation. You know, these patients were just in their head, having a chill time, chilling with sheep, doing whatever they want, and now they're in the P-Town parking lot. They're not gonna be happy. You might see vomiting. If we push it fast, they might projectile vomit. You might notice tremors or shivering. Elevated blood pressure. Something that's not really talked about, if we slam this medication, it has a higher chance of flash pulmonary edema, which is a lot of fluid buildup in the lungs. And you guys can't fix that, can you? You guys don't have stuff to get fluid out of the lungs? Okay.
Has anyone in this group had to administer Narcan so far since you've been working for VHS? Yes? 1, 2, 2? Anybody else? Okay. Do you mind sharing that experience with the group? If you're comfortable with it, you don't have to. Okay. Okay. Did you see any of these side effects or?
He was agitated when he came out.
He was agitated? Okay. Right. One thing we've identified so far in teaching this, and then when the police were here with us earlier, is a lot of folks that overdose on these drugs, they are either ashamed or they're afraid that they're going to get in trouble, right? So their friend has driven them up here to behavioral health, they've opened the door and they've put them in your parking lot, right? We had that happen a lot at our stations, right? Someone will drive their friend, right? Their friend, put them out on the curb, drive a block or two away and then call 911, right? There's someone at your fire station 1 who's overdosed, right? So anybody else want to share? Did you say that you, okay?
When she came to, she was pretty aggressive.
Okay.
Angry with me.
Okay.
And her first concern was, I need to leave, this cop's gonna come.
Right.
I was calling 911 for paramedics to come.
Right.
And she was furious because she thought I was calling police.
Right.
Mm-hmm.
Yeah.
So yeah, she was very aggressive towards you. She was mean. She thought you were calling for the police officers when you were calling for us. It is not, for some reason, common knowledge that if you call for an overdose, you are not going to get in trouble. You will not get arrested. And that is so people do call 911. The cops aren't going to show up and arrest the people when they're calling for help. And I know that's a huge misconception as well. Like, oh, well, if I call for them, you know, my buddy that's overdosing with me, I'm going to go to jail. No, when police officers are in that situation, they cannot arrest people involved in that. That is to encourage them to call 911 and call for help.
Yeah.
So hopefully we can break that stigma around it, and hopefully more people do start calling 911 for help.
Yeah. And that should be part of y'all's protocol. I don't know if it already is, but before you even interact, the phone call should already be going through to our 911 dispatch to get us on the way there, and we're going to cover some of the reasons for that.
All right. So one of the first things that we are taught in school is you protect yourself first. I protect myself, then I protect my partner, then I help the patient. If I get hurt, then no one's going to help the patient, and then I need someone to help me as well. You protect yourself. Us as EMS providers, I'm not going into any situation that I think might be unsafe. If I'm reading my dispatch notes and I'm like, something sounds a little off, I'm calling for police officers. The police officers will get there first, and then they will radio and tell me when it is safe. If I have a bad feeling about anything, I'm not going. Overdoses, they automatically respond with us. They will be there for every overdose. All right, PPE. For every single patient, we should be wearing gloves to begin with, right? But especially when we have overdose patients, we should be wearing gloves, nitrile gloves, and a mask. While it is very rare, it can happen to where you get in contact with that drug and can have bad effects. I actually have an article pulled up that I can show you guys after this presentation that is from my hometown back in Indiana. We had a firefighter respond to a call. They gave the patient Narcan. Once they woke up, the patient coughed in his face. Guess what happened? He overdosed, went unresponsive, ended up in the ICU. It can happen. It is rare, but it can happen.
Does your Narcan kits come with any type of protective equipment?
Yes.
What is it? What is it?
The bags do.
What's that?
I think the bags do.
It
The
comes with
bags
gloves?
do, right? At least gloves minimum, okay?
And a mat, and they also have the plastic covering, so that if in the event you need to give CPR, you can.
Okay. So please, they're in there for a reason. Ashley just explained, use that. If you're gonna pull out the Narcan, PPE first, gloves on first, before you touch anything, okay?
Any patient, but especially an overdose patient.
Right.
All right, so the number one hazard that comes to my brain when I think of an overdose is needles. Has anybody been stuck with a dirty needle before? Yep. And I had to get tested for everything. That patient had to get tested for everything, and it was not fun. You do not want to get stuck with dirty needles. Do not put your hands in anybody's pockets. I am not doing that. I will call for police officers and they can search the patient. They know how to do it safely. I don't. That's why I got stuck with needles before. We're not going to do that. Another thing, so you don't have to out yourself for this, but I heard that we have people running to the parking lot to help people in their vehicles. We should not be going to anybody's vehicle to administer Narcan. When somebody overdoses in the driver's seat, where's that foot?
Gas pedal.
It's on the brake. And as soon as you wake them up, your foot's gonna get ran over, you're gonna get ran over. Do not go to anybody's vehicle. Not only that, you don't know if there's weapons in there. There could be weapons. There could be another person with them. It could be a setup. They can ambush you. That has happened before. Do not go to anybody's vehicle. Be aware of bystanders that might become a little erratic as well. Why aren't you helping him? Why aren't you quick enough? What's going on? Why isn't he waking up? Yada, yada. And now you're by yourself out there. Please don't. Call for help. All right. We should be calling 911 for any kind of overdose patient. Overdose is going to cause the patient not to be breathing properly. We have equipment to breathe for the patient. Do you guys? Not from what I know. No. So the overdose is going to cause the patient to not be breathing normally. Narcan is going to reverse that so they start breathing. Let's say we don't have Narcan on the medic. Let's say on the ambulance, we don't have Narcan. But I'm able to breathe for that patient the entire way to the hospital. They will be okay. If the Narcan doesn't work for you guys and they don't breathe at some point, they're going to die. We have the equipment to take care of that patient. Patients should be evaluated in the hospital every time they're given Narcan. Narcan can wear off. It's roughly 30 to 45 minutes and then it's going to wear off. What happens when it wears off? They're going to overdose again. They can wear off and they can overdose again without taking any more drugs. That's why when they go to the hospital, they're evaluated for about 2 to 3 hours and then they release them. Just to make sure the drugs ran its course and it's out of their system and we're not at risk for overdosing again. What if they come to your guys' building, they get some Narcan, they're good now, they go behind a dark building. No one finds them. They overdose again. They need to go to the hospital and get checked out. Now, another huge thing, liability issues. So there is a Good Samaritan law that protects you guys if something were to happen, you guys given Narcan and everything else. I don't know if it protects you guys from getting sued by patients or family, to be honest with you. I have no idea. But what EMS can get is a refusal. That is a legal document that will hold up in court, that does get brought up in court cases, that I can bring out and it says this person's name, this person's date of birth, everything, and they signed right here saying they don't want to go to the hospital with me. Do you guys have legal documents saying that they can refuse care? I don't know. I don't think so. So when you call us, we can take the legality issues away. Help us, help you guys.
One of the other things it does too by calling 911 is it gets the police involved. Again, I know usually the users are afraid of an arrest or getting in trouble. This also allows the police to kind of track uses of opioids and heroin, right? And also when they see trends when overdoses are getting more and more repeated. So they can take that information, try to do whatever narcotics division does to try to track down maybe where the drugs are coming from, how often. So they do use that information to kind of do their investigations as well. So that's another benefit to using 911 and getting the police out there.
Another thing that was brought up during the last class is we had a gentleman saying that drugs are on the rise. They're becoming more synthetic to where they require more Narcan to be used. Something that was very common for me when I lived in Northwest Indiana was I have never seen 1 unit of Narcan work on a patient before until I moved here. It was taking us like 5-6 units of Narcan for it to actually reverse the overdose. We carry 28 boxes of Narcan on our ambulance back home to protect us and the patient in case we were to overdose from the patient. Here, everybody, you guys got 1 box each? If you call us, we have a lot more on our ambulance. Okay? All right, just some reminders. Protecting yourself is number 1. Protect yourself, then protect your coworker, then help the patient. Patients last. You can't help nobody if you get yourself hurt. You can help, but do not forget to call for extra assistance. We're here to help you guys. And Narcan should only be used in an emergency situation. Once again, somebody running around acting crazy, don't hold him down and shove Narcan in his nose. We are only going to use it if they're having breathing problems. And I feel like this is probably hard to see, but I did want to include this chart right here. These blue lines are from 2023. That is the overdoses per month. Sorry, guys.
No, you're good.
And then this orange line is 2024. This gray line right here, this is this year. Almost half has been cut because of our wonderful CRT team and you guys do what you guys do. So that's really awesome. All right.
Does anybody have any formal questions about opioids, the safety that goes along with it, or anything that kind of came to mind as we presented some of this today? Were you familiar with most of this material? Yes, most of you were? Okay. Some of them no. Okay. Biggest takeaway again from today is just to be more situationally aware. I think a lot of times, even in our profession as first responders, we have a tendency to want to run right to the problem immediately, right? And sometimes we can get tunnel vision and miss out on what's really important and what should be our main concern, right? Because two people can look at the same thing and not see the same thing. So for you all, again, I'm not sure if the push was because y'all are seeing more people being brought to behavioral health with these drug problems, with overdose problems. But first and foremost, please protect yourself, okay? I think the last group mentioned that there is some type of paperwork that y'all fill out when you have a situation when Narcan's given. Is everybody familiar with that? Does anybody know what that's called?
Incident report.
Incident report, okay. Please fill out your incident reports and please call 911 for every drug overdose that you have at your facility, okay? It is helping get these people the help that they need. Whether they want it or not, it is a step in the right direction in getting them the help that they need. Because ultimately, that's what the whole goal is here. So, and for you all to do it in a safe manner. So, no formal questions? One in the back?
How do you know where they are in city buildings? You work in City Hall, I have no idea where and if there's Narcan.
So, at behavioral health, you all carry it where? Does everybody have it? Is it?
Every office.
Okay. So at other city buildings, I do not believe that there is a Narcan location where you can just go and pick it up. At any other city buildings, you're going to call 911. So you're going to have the first responders come out and assist with that. So that is a good question though, because with the drug usage and also to piggyback on what Ashley said, the stuff that they're putting in the drugs now is not the heroin from 20 years ago, okay? That's another thing that you have to understand. The stuff that they're putting in it now is made to take down
A horse.
or an elephant, right? It's like a tranquilizer, right? Our bodies are not made to metabolize that type of chemicals, right? Which is what causes these overdoses, which causes all these other side effects. So just keep that in mind and just be aware of that, right? Again, back to what Ashley said about taking the Narcan and just squeezing it all at one time. The goal here is just to keep these people breathing until we get there, right? That's the whole goal for you all, right? When you give the medication too quickly too, you end up with all that extra stuff that goes along with it. So, all right, so real quick, we'll just go across the room. Tell us, out of this entire group, let's get five things that you learned today that you didn't know before. So just throw your hand up if you have a thought, and we'll go to each one of you.
I didn't know slamming was a thing, and that fluid can build up in the lungs.
Okay, right? So giving the medication too quick can be a problem. When we're taught in EMT school, EMT to EMT advanced, all at the paramedic level, you give the medication at a certain rate till you get that desired effect. And that's essentially what the Narcan does, right?
Yes.
And it allows it to get in there and to absorb.
So on the ambulance, for example, we're able to give Narcan through an IV, so I can control even more how much I'm giving.
Right.
Typically, I want to give just enough for my patient to be breathing.
Right.
And like I was saying from before, when I moved out here, it was definitely a culture shock where I gave one whole vial of Narcan and they jumped up, and I'm like, well, I've never seen that work so
Yeah.
well. Obviously, for you guys, just keeping the patient alive, I understand it can cause side effects. I'd rather have the side effects than them dead.
Right.
So just remember that. I
Yeah.
want you guys to give it still whenever it's appropriate. And you're not the one that caused them to do
Correct.
it. Sorry if you're vomiting, but
Right.
rather than be alive.
And then, Yep.
I wasn't aware that after 30 minutes after giving them Narcan, they can overdose.
Right.
That
Yes.
was surprising to hear.
right.
Mm-hmm.
So that Narcan is just a temporary block on that neurological level, right? It blocks those receptors temporarily. Once that get metabolized and wears off, then that opioid can kick back in and create that euphoria, right? They go back to the planet of the bunnies, wherever that is for however long it is and however good it feels, that's where they go, right? And then if it doesn't get corrected, that respiratory drive drops again, they relax, and if they're laying face down or whatever, that's what happens. So yes, even when you bring them back and they yell at you and I want to drive and get away, try your best to keep them there so we can get them to where they can be evaluated.
I was gonna say the same thing, so as far as like not knowing that they can still overdose after you give them.
Right. Yep. And they don't have to go put more heroin in. It could be what's already in their system.
Like,
Okay.
let's say the high lasts for an hour.
Yep.
30 minutes, you still have a half hour, so you're done riding that
I
train.
don't know how you can get sick from the overdose. Well, they did say something about that, but the spitting
Right.
can make you get it too.
Right. So that's a third one, right? You can get exposed just by helping this person. Your body can absorb whatever they've taken and it can metabolize in yourself and you can get the same response. And some of these people that have used drugs for years, their bodies are kind of adapted to it, whereas it would be a shock to your system to put heroin or a large dose of this in. So, yes, sir.
In his case, could he test positive for that?
Yes.
Like on the urine screen?
Oh, yeah.
So
Yeah, it's going to show up in his system.
this firefighter, they used Narcan on this patient. They had him in the ambulance. They were able to get him to wake up, and the man coughed and snorted in his face, and then this firefighter went unresponsive. This is actually my hometown, and I talked to quite a few of them that were there. He was in the ICU for 3 days. He did have an actual overdose, and it did show in his system.
So again, he may not have got coughed on and immediately went unconscious, right? He could have went home. I don't know the exact story, but right, it could happen later on, right? Once your body metabolizes, absorbs it. All right, so we got 4. Give me one more. That's something that one of you learned today. I know this was new for all the recruits.
Yeah.
Does anybody down there want to give it a shot?
I have some different slang terms for the different drugs.
Okay.
Different drugs.
Yeah, the slang
Right.
names for him.
Yep, the last 2 groups mentioned that. Hey, these are names that we didn't know. So if they bring you someone and they don't say, hey, they use heroin, but they use the pink drink or the
Purple
O
drink.
or the D or whatever, right? Be familiar with those terms, okay?
And I will say the one that I've heard the most here is cap. Oh, he used half a cap. Oh, he used 1 cap. I've heard cap the most used here. And I never heard that term until I moved here either.
Yep.
So I was like,
Any other questions before we cut you loose? Anything else you learned today? All right, we just want y'all to be safe, first and foremost, right? You all do a lot for the city, and you probably feel underappreciated, right? But you are making a difference. That chart that she just showed up there is this city trending in the right direction, which is good, right? And it takes a village, right? Man uses these types of drugs to get rich off of people. That's the whole purpose of it, right? They don't care if they die. They don't care about the user. They just care about the money. So it takes a village to oust something like this.
and that's proven that it's working. So
Yep.
good job to you guys
Yep.
too.
All right. That's all we have. We do have some attendance certifications for you. All right?
Thank you guys.
Yep. Appreciate you.